going to talk a little bit about tummy tucks, or medically known as abdominoplasty. I get a lot of questions about this procedure, so we thought we'd make this video to answer some of those questions. First question I get asked is sort of who are the best candidates for the procedure. And I would say that for me, my patients, probably the best candidates are patients who are relatively fit, take pretty good care of themselves, and just have sort of extra skin sort of in the area below the belly button. And for the most part, these are patients who have gone through prior pregnancy, they're finished having kids, and they've lost their post-pregnancy weight, and some of their skin has come back, but there's just a small portion underneath the belly button that really just won't go away. There's also sort of a second population of patients, which is sort of the post-bariatric patient, which are patients who've lost a lot of weight either through gastric bypass or just through diet and exercise alone. And I'd say in both these populations of patients, you have sort of oftentimes extra skin sort of hanging underneath the belly button. So there's some popular misconceptions about tummy tucks. Some people often feel that the tummy tuck is really done to get rid of extra weight and really extra fat in the abdominal area. And that's actually not really what it's for. It's really more of a skin operation rather than a fat operation. Let's talk a little bit about the operative details. So the tummy tuck operation usually lasts about 3 hours. There's some variation from patient to patient, sort of depending on their size and depending on sort of what they're looking for, since the operation is sort of tailored individually. There's probably about, I'd say my patient population, maybe about 85% of patients or so who will also get some abdominal liposuction in the flank areas, sort of in the side areas, just to give them a little bit better of a waist definition. In terms of the operation itself, the design is really to get rid of that extra skin sort of that's hanging underneath the belly button. So essentially I'll take out a wedge of tissue, sort of an elliptical shaped wedge below the belly button down to the area of the pubic hairline. And by taking out all that wedge of tissue, I'll take out the skin and actually the fat that's attached underneath it. So it does remove some fat, but it's just, as I mentioned earlier, the purpose of the operation really is because of extra skin. And after taking this out, then I'll take out the skin that's above the belly button, sort of lift that up, and then pull it down to kind of cover up that area that was resected. So before pulling that down, what I'll do is oftentimes I will do a horizontal tightening too. So it's sort of a tightening in 2 layers. With pregnancy or with massive weight gain, oftentimes the muscles that are usually start out sort of tight like this, they can sort of be stretched apart. And so during the tummy tuck operation, once we lift up the skin and have access to it, I'll pull those muscles back together to kind of get them back into the original configuration and put some sutures in the area to really kind of secure things in place. So there's really a horizontal tightening in the deeper layer, and then after that's done, sort of a vertical tightening of the skin layer. I get a lot of questions about the belly button. Oftentimes people ask, will I have my same belly button or will I get a new belly button? And the answer is, in the vast majority of my patients, I keep them with their original belly button. The only difference is when I pull that skin down, after taking out the skin below, I'll make a new little opening or like a new window for the belly button to kind of poke out of. So patients will keep their own belly button, just as a new window for it to come out and be exposed to the outside world. In terms of post-op recovery, most patients after the tummy tuck operation do have a lot of dressings on. I do put a compression garment or a abdominal binder over the area of the tummy tuck, and the idea is really to give a little bit more support, kind of push things into place so that they kind of heal well together. During the operation, I do use drains, and what those are small little tubes that come out of the skin and sort of get rid of all the extra fluid that the body sometimes does want to accumulate in those areas. Drains will stay in usually about 2 weeks or so. Again, it sort of depends on the patient. I say for my patients, usually the range is 1 to 3 weeks, but again, the vast majority of patients really about 2 weeks. I'll take those out here in clinic. It's very straightforward to do. And really, a lot of this bruising and swelling is gone by about 2 weeks. And so I'd say for the majority of patients who work desk jobs, which seems to be the majority of people these days, I'd say most of them can go back to work right around the 2-week mark. Some go back earlier, some a little later, but that's a pretty good time frame to sort of keep in mind. In terms of going back to the gym, doing all sorts of physical activity, I'd say really about the 6-week mark is oftentimes for most patients when they can go back to that. Again, I see patients in my practice pretty frequently after abdominoplasty, so I can kind of monitor their healing, make sure there are no problems, if there's small issues, sort of address them early on. And so I'll sort of tailor when I see patients can go back to all those activities, sort of based on their individual healing. But again, most patients, I'd say 6 weeks is a reasonable time frame for expecting to go back to the gym and all those sorts of things.